Madam Chair. Dr. Evans, I'd like to raise an issue that is extremely serious but gets very little attention. As co-chair of the Bipartisan Maternity Care Caucus, I'm very concerned about the impact COVID-19 has had on the mental health of expecting and new mothers. As you may know, maternal mental health, including postpartum depression and other mood and anxiety disorders, are the most common complications of pregnancy and childbirth. It affects 1 in 5 women, which translate into 800,000 new mothers each year in the United States. And tragically, suicide and overdose are the leading causes of maternal mortality for new mothers. Recent studies have shown pregnant women and new mothers are experiencing increased anxiety and depression during the pandemic at 3 to 4 times the rate prior to the pandemic. And women of color and women who live in poverty are disproportionately impacted by both maternal mental health conditions and the pandemic. Dr. Evans, could you please describe how maternal mental health issues differ from other mental health disorders and if they require different approaches and therapies to address?
Sure. Thank you for that question. Yes, maternal mental health issues are different in some important ways that we have to take into consideration as we work with women. When I was commissioner for behavioral health in Philadelphia, I funded programs specifically for women who were going through their pregnancy. As you noted, postpartum depression is the most common complication within childbirth. One of the other distinguishing aspects of postpartum depression is that many of the women who are experiencing postpartum depression are experiencing it for the first time during childbirth, which means that they are not typically already connected to services. One of the things that I think is really important is that we have a multi-systemic approach to this issue. For one thing, we need to make sure that we have integrated within perinatal services mental health treatment, particularly screening and identifying women who might be at greater risk or maybe in the early stages of showing signs and symptoms of depression. I think we have to make sure that practitioners, both physical health practitioners, OBGYNs, and pediatricians are aware of the prevalence of postpartum depression and understand how to make connections to the mental health system. And we need to make sure that mental health providers understand the unique issues that women and mothers who are experiencing postpartum depression have. For example, the level of stigma and the issues around stigma are very different than the general population. You're already talking about a stigmatized condition, but it is particularly difficult for mothers who have elevated expectations about how they should be responding after childbirth. So I think that the most important thing is to make sure that we have the funding. When I funded those programs, there were some complications and particularly Medicaid funding around how many services or different types of services that you could bill for in a particular day. And so we had to do some very creative financing in order to fund those services. So I would put at the top of the priority list, making sure that we have good ways of funding those services and that we reduce those barriers so that those services are available to women during that process.
Okay. Dr. Evans, you touched a little bit on what my second question was going to be, and that is, how do we improve maternal mental health awareness, diagnosis, and treatment in this country to ensure that we get the best possible maternity outcomes for every mother, infant, and the family?
Well, I think that mental health treatment, early screening, early identification needs to be just a part of the standard of care. That no woman, in my view, should go through childbirth without the questions and screening around mental health and whether they're having mental health challenges. That is a systemic thing that we can do, but we also have to make sure, as I mentioned earlier, that practitioners, both physical health and mental health and behavioral health providers, understand the unique challenges that women face that they have that education and they understand how to treat those women given the particular challenges that they're experiencing during childbirth.
Thank you. I see my time is up. I yield back.